Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having a tough time lately with this chest pain and shortness of breath. It started getting worse over the past week. I've been working in my basement, renovating it, and I guess I've been exposed to a lot of paint and mold down there.
I see. Have you noticed anything else during these episodes? Any other symptoms like coughing or wheezing?
Well, yes, there's some coughing, and I feel like my chest is just really heavy, almost like I'm being punched. It's pretty concerning.
Understandable, especially with your past medical history. Let's also talk about your toe and elbow. You mentioned ongoing discomfort with your toe and issues with your elbow?
Yes, the toe has been a problem since back in '79 when I got frostbite and it turned black. It's been pretty painful ever since, especially when I'm walking for a long time. And my elbow, it started hurting a few months ago. It feels really weak, and I've been using an elastic band to support it when I lift anything.
It sounds like these issues are significantly impacting your quality of life. Have you tried any treatments for your toe or elbow before coming here?
Not really for the toe. I just try to keep off it when it gets bad. For the elbow, just the band and some over-the-counter pain relief when it's really bad.
Okay, thank you for sharing that. You also mentioned earlier about your past cocaine use. When was the last time you used any?
I last used cocaine around June or July. I've been trying to stay clean since then.
That's good to hear you're taking steps towards your health. Based on your history, we ran some tests during your last visit. Your blood pressure was 130/85, heart rate at 78 beats per minute, and other vitals within normal ranges, but your oxygen saturation was at 94% on room air. Your laboratory tests were mostly within normal limits, except for elevated liver enzymes. The lipid profile showed elevated cholesterol levels, and your pulmonary function tests indicated a mild restriction.
What do those results mean for me, doctor?
The elevated liver enzymes could be a result of your past substance use, and we need to monitor this closely. The mild restriction in your lung function tests could be related to your exposure to chemicals and possibly your past smoking habits. It's good news that your echocardiogram and chest X-ray didn't show any severe problems, but there are early signs of fibrotic changes in your lungs.
So what should we do moving forward?
Firstly, it's crucial to avoid further exposure to paint and other chemical fumes. This will help prevent further damage to your lungs. For your chest pain and breathing issues, continuing to use the inhaler as we demonstrated should help manage those symptoms.
And what about my toe and elbow?
For your toe, referral to podiatry is necessary. They can offer more specialized care and treatment options. As for your elbow, seeing an orthopedic specialist will help us better understand the cause of the pain and the best treatment strategy. We might consider an MRI to get a detailed look at the structures in your elbow.
Okay, that sounds like a plan. How soon should I do these follow-ups?
I would suggest making the appointments as soon as possible. It's important to address these issues promptly to avoid any further complications. I'll arrange for the referrals and have our office help set up the appointments for you.
Thank you, doctor. I appreciate your help in figuring all this out.
You're welcome. It's important to manage these issues effectively, and we're here to help you through this. We'll see how things are progressing in our next follow-up in a month. Make sure to complete the lab tests and imaging studies we discussed today. Any questions before we wrap up?
No, that covers everything. Thanks again, doctor.
Of course. Take care, and we'll see you soon. Remember, if anything changes or if your symptoms worsen, please don't hesitate to contact us.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. I've been having quite a rough time since my last visit. I tripped over a curb recently, and it's really aggravated my arm, shoulder, back, and neck. There's also this nagging pain when I take deep breaths, which is worrying me.
I see you're in quite some discomfort. Let's take it step by step. Tell me more about your fall and any immediate symptoms you noticed afterward.
Well, it was quite sudden. I didn't lose consciousness or anything, but the impact was pretty hard. I've had continuous pain since then, mostly around my shoulder and back. Breathing deeply has become difficult without feeling a sharp pain, which makes me think I might have hurt something more internally, maybe my ribs.
All right, we'll definitely look into that. How have you been managing your diabetes and other conditions lately?
My diabetes has been particularly challenging. My glucose levels have been off the charts. Even with the insulin adjustments, my last reading was extremely high, which is frustrating. I also have this constant worry about my blood pressure and the clot risk from factor V Leiden, which doesn't make things any easier.
I understand that it's a lot to manage. How about your daily routines? Are you able to keep up with your physical activities or any changes in your diet?
It's been hard, especially with the pain from the fall. I use a cane to get around because of my past injuries and the neuropathy in my feet. Fine motor skills are a challenge too. Even holding things can be painful at times. My diet hasn't been the best either, which probably isn't helping my diabetes.
We will address these issues systematically. Have you been following up with any other specialists, like your dermatologist or psychiatrist?
Yes, I've been keeping those appointments. The dermatologist is monitoring a few areas of concern, and my psychiatrist has been helpful with managing my mood and stress, which has been a lot worse with all the health issues coming up frequently.
That's good to hear. Keeping up with your overall health is crucial. Let's also make sure your medications are optimized. Have there been any side effects or concerns about the medications you're currently on?
Not particularly, though I do worry about the long-term effects. I've been advised against Tylenol because of my liver enzymes being elevated, and now I just stick with ibuprofen when the pain becomes unbearable. I'm always cautious about bleeding risks because of the warfarin.
Right. We need to keep a close eye on that, especially with your history. Now, let's go over the next steps for managing your current concerns, and I'll provide some updates based on today's examination and your recent lab results.
I appreciate that, doctor. I just want to feel better and manage my conditions more effectively.
Absolutely. Let's optimize your health step by step. Based on our discussion and the examination today, here's what we have. Your glucose control is clearly a priority given the recent extremely high readings. Your A1C has come down a bit to 9.9%, but it's still far from the target. We need to get this under better control. Your blood pressure is relatively stable at 140/82 mm/Hg, but given your overall risk factors, we should aim for tighter control. Your kidney function shows some signs of strain with an eGFR of 59, indicating moderate kidney damage. It's crucial we monitor this closely. We will adjust your insulin doses further and involve a pharmacist to closely monitor your diabetes management. We need to perform an X-ray to assess for any possible rib fractures from your fall. This will help us address the pain and ensure there are no further complications. We'll review all your medications in detail, especially considering your elevated liver enzymes and the effectiveness of your current hypertension and gout management. Continue regular follow-ups with your dermatologist and psychiatrist. It's essential to manage every aspect of your health. Since NSAIDs are your current option, we need to be vigilant about your kidney function and potential bleeding risks. We'll schedule a follow-up in 3 months. However, I want you to reach out immediately if you notice any worsening symptoms or new concerns. Does that sound manageable?
Yes, doctor. It sounds thorough, and I feel more reassured that we're addressing everything. Thank you for going through all this with me.
You're welcome. I'm here to help you through this. Let's work together to improve your health step by step.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, I'm your nurse today. May I have your full name and date of birth for our records?
Yes, it's John Smith, born on June 2nd, 1980.
Thank you, John. Can you please tell me the reason for your visit today?
I've been having severe chest pains and difficulty breathing since last night.
I'm sorry to hear that. Have you had any previous surgeries or chronic illnesses?
Yes, I had an appendectomy when I was 12 and I have type 2 diabetes.
Do you take any medications for your diabetes?
Yes, metformin and sometimes insulin.
Great, that's very helpful. Do you have any allergies we should be aware of?
I'm allergic to penicillin.
Thank you for that information, John. Let's get you settled in, and we'll take good care of you.
Now look at question 26.
Good morning, everyone. I want to discuss the updated health and safety protocols we're implementing next week.
What are the major changes we should expect?
Firstly, we're enhancing our cleaning procedures. Each area must be sanitized twice per shift and logs must be maintained.
Additionally, we're introducing mandatory health screenings at the start of each shift. Anyone displaying symptoms will be sent home to recover.
How about personal protective equipment?
PPE will be provided to all employees and must be worn at all times in the facility. We'll also hold training sessions on proper PPE usage.
Will there be any changes to our break schedules?
Yes, breaks will be staggered to reduce the number of people in the break room at one time. Any questions?
No, that covers everything. Thanks for the update.
Now look at question 27.
Good morning, team. Today we'll be discussing the procedural steps for the upcoming heart bypass surgery.
What's the estimated duration of the surgery?
We're looking at approximately 4 hours, assuming no unforeseen complications. We'll start with a median sternotomy to access the heart. I'll need the perfusionist ready with the heart-lung machine.
I'll make sure the equipment is prepped and ready before we begin.
After that, we'll harvest the saphenous vein from the leg for the grafts. It's crucial that the grafts are handled with care to avoid any damage. Post-surgery, the patient will be in intensive care for close monitoring. Any questions on your specific roles during the operation?
I'll oversee the anesthesia and patient vitals throughout the procedure.
Excellent. Let's all review our protocols and be prepared. Our goal is a successful surgery with a smooth recovery for our patient.
Now look at question 28.
I'm excited to introduce our new community health initiative, which focuses on increasing access to mental health services.
What will the initiative specifically involve?
We're setting up mobile health clinics that will travel across underserved areas to provide mental health screenings and therapy sessions. There will also be a 24/7 hotline for immediate support and guidance on mental health resources.
How can we assist with this initiative?
We'll need volunteers to staff the mobile clinics and operate the hotline. Training will be provided for everyone involved.
Sounds like a great initiative. How do we measure the impact?
We'll track the number of individuals using the services, follow up on their progress, and adjust our strategies based on the feedback we receive.
I'm looking forward to seeing the positive effects in our community.
Now look at question 29.
I need some guidance on administering the new anticoagulant rivaroxaban. Are there any special instructions?
Yes, rivaroxaban should be taken with the evening meal to enhance its absorption. It's crucial not to miss any doses.
What should I watch for in terms of side effects?
Look out for signs of bleeding, including unusual bruising or bleeding gums. Patients should report any persistent headache or dizziness.
Is there anything else we need to consider?
Yes, rivaroxaban can interact with other medications like NSAIDs or certain antidepressants, increasing the risk of bleeding. Always check for medication interactions.
Thanks for the detailed information. I'll make sure to monitor the patients closely and keep all this in mind.
Now look at question 30.
Today, we're going to focus on proper lifting techniques to prevent workplace injuries. Let's start with the basics of body mechanics.
What's the most important thing to remember when lifting?
Always lift with your legs, not your back. Keep your back straight and bend your knees. When you're picking something up, keep it close to your body to minimize strain.
What if the item is too heavy?
Never try to lift something that feels too heavy. Always ask for help or use a lifting aid. Let's practice with these dummy weights. I'll demonstrate first, then each of you will try while I provide feedback.
Great. I think these practical exercises will really help us remember the correct technique.
Exactly. Practicing will help make these techniques second nature, reducing the risk of injury significantly.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello, everyone, and welcome to today's healthcare seminar. I'm Dr. Emily Thompson, a specialist in preventive medicine, and today we're going to explore the profound impact of physical activity on managing chronic diseases, focusing on a complex case study that highlights the transformative power of movement in clinical practice. Today, I want to discuss the case of Mr. James Carter, a 62-year-old patient diagnosed with type 2 diabetes and osteoarthritis. Like many patients with chronic conditions, Mr. Carter struggled with managing his health primarily due to a sedentary lifestyle that exacerbated his conditions. His story provides a vivid example of the complexities and potential solutions in managing chronic diseases through lifestyle interventions, particularly physical activity. Mr. Carter initially presented with poorly controlled diabetes and significant osteoarthritis-related mobility issues. His treatment regimen consisted mainly of medication, including metformin for diabetes and NSAIDs for joint pain, along with dietary recommendations aimed at weight management. Despite these measures, his health outcomes were suboptimal, with his HbA1c levels persistently above the target and his mobility declining. Acknowledging the growing body of evidence supporting the role of physical activity in managing chronic conditions, we decided to integrate a structured exercise program into Mr. Carter's management plan. This decision was informed by a comprehensive review of literature, including studies from Harvard and other leading institutions, which suggest that regular physical activity can significantly improve glycemic control and reduce symptoms of arthritis. We introduced Mr. Carter to a tailored exercise regimen designed to accommodate his physical limitations while effectively managing his conditions. The program started with gentle, low-impact activities such as swimming and cycling on a stationary bike, activities that are less taxing on the joints. Additionally, we incorporated strength training exercises to improve muscle mass, which is crucial for glucose metabolism and joint support. Over the course of 6 months, Mr. Carter experienced significant improvements. His HbA1c levels decreased from 8.5% to 7.1%, indicating better diabetes control. More impressively, he reported a marked decrease in joint pain and enhanced mobility. These changes not only improved his quality of life, but also reduced his dependence on medications. This case illustrates the necessity of integrating physical activity into the treatment plans for chronic diseases. The benefits Mr. Carter experienced underscore the dual role of exercise in both managing existing conditions and preventing potential complications. According to the World Health Organization, adults aged 18 to 64 should engage in at least 150 minutes of moderate-intensity aerobic physical activity per week. This guideline is particularly pertinent for patients like Mr. Carter, where physical activity can serve as a cornerstone of disease management. The integration of physical activity into clinical practice, however, presents several challenges. Firstly, there is the need to personalize exercise recommendations to fit the specific health status and capabilities of each patient. In Mr. Carter's case, careful selection of low-impact exercises was crucial to avoid exacerbating his arthritis symptoms. Secondly, there is often a lack of resources and support for patients to engage in physical activities safely and effectively. To address this, healthcare providers must advocate for comprehensive care strategies that include access to fitness programs and facilities tailored to the needs of those with chronic conditions. Fostering a collaborative approach among healthcare providers, including physicians, physical therapists, and exercise specialists, is essential for creating and maintaining effective exercise programs. Such collaboration ensures that exercise prescriptions are not only medically appropriate, but also optimized for the best possible patient outcomes. Mr. Carter's case highlights the importance of physical activity in the management of chronic diseases. As healthcare providers, it is our duty to promote and facilitate the integration of exercise into the treatment plans for our patients. This approach not only improves specific health outcomes, but also enhances overall well-being. It's crucial that we not just treat the disease, but empower our patients to take active roles in managing their health through lifestyle changes. Remember, every movement counts, and as clinicians, our support can be the catalyst for transformative health changes. Thank you for your attention, and I look forward to seeing how we can all incorporate these practices into our work to better assist our patients in leading healthier, more active lives.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Thank you for joining today's educational webinar. Our focus today is on a vital topic in rheumatology, giant cell arteritis, GCA, a form of vasculitis that primarily affects the elderly and can lead to severe complications, including irreversible blindness. We will delve deep into the pathophysiology, clinical presentation, and current management strategies for GCA, enriched with a detailed case study. Giant cell arteritis, also known as temporal arteritis, is an inflammatory disease of the large and medium-sized arteries. Typically, it affects branches of the external carotid artery, including the temporal arteries, which can become swollen and tender. The disease primarily affects individuals over the age of 50, with a higher prevalence in women and those of Northern European descent. The pathophysiology involves an immune-mediated inflammation that leads to the thickening of the arterial wall, narrowing its lumen, and potentially leading to ischemia of dependent tissues. The clinical presentation of GCA is highly variable, but classically includes new onset of a localized headache, scalp tenderness, visual disturbances, and jaw claudication, the latter occurring due to ischemia of the masseter muscles during mastication. Systemic symptoms such as fever, weight loss, and malaise are also common, reflecting the systemic nature of the inflammation. Our case study involves Mrs. Thompson, a 68-year-old Caucasian woman who presented to her primary care physician with a 2-week history of a new severe headache localized to her right temporal region, accompanied by intermittent jaw pain while eating. Her medical history was significant for hypertension and type 2 diabetes, both controlled with medication. Given her age and symptoms, there was a high index of suspicion for GCA. Immediate action was crucial given the high risk of complications associated with GCA, such as blindness due to anterior ischemic optic neuropathy. Mrs. Thompson's initial blood test showed significantly elevated inflammatory markers, with an erythrocyte sedimentation rate, ESR, of 80 and a C-reactive protein, CRP, level of 50 milligrams per meter. These findings further supported the clinical suspicion of GCA. Prompt treatment with high-dose corticosteroids was initiated, prednisone 60 milligrams daily, to reduce artery inflammation and prevent vision loss. A temporal artery biopsy was performed to confirm the diagnosis, which showed characteristic findings of GCA, including inflammation, presence of giant cells, and disruption of the internal elastic lamina. Management of GCA requires not only treating the acute phase, but also maintaining long-term suppression of inflammation to prevent relapses. Mrs. Thompson's corticosteroid dose was carefully tapered over the following months, monitoring her symptoms and inflammatory markers closely. However, due to her diabetes, steroid therapy exacerbated her glucose control. This situation required introducing a steroid-sparing agent, methotrexate, to reduce her steroid dosage while maintaining control over the GCA. Methotrexate has been shown to be effective as a steroid-sparing agent in numerous studies, and in Mrs. Thompson's case, it allowed a reduction in her steroid dose without a flare-up of her symptoms. This change significantly improved her glucose management and reduced other steroid-related side effects, such as hypertension and osteoporosis risk. Over the next year, Mrs. Thompson's condition remained stable with the adjusted treatment regimen, showcasing the importance of personalized treatment plans in managing chronic conditions like GCA. Her case highlights the necessity of interdisciplinary care involving rheumatologists, primary care physicians, and endocrinologists to address the various facets of the disease and its treatment impacts. Giant cell arteritis is a complex autoimmune condition that requires prompt diagnosis and aggressive treatment to prevent serious complications, particularly irreversible vision loss. The case of Mrs. Thompson illustrates the typical presentation and complexity of managing GCA, emphasizing the need for vigilance in elderly patients presenting with new-onset headaches and systemic symptoms. Ongoing research and clinical trials continue to refine our understanding and treatment of this condition, promising better outcomes for patients through tailored therapeutic approaches and the potential development of new pharmacological therapies. Thank you all for your attention. I hope this session has enhanced your understanding of giant cell arteritis and its management, and I encourage you to apply this knowledge to improve patient care in your own clinical practices.